Hello, and welcome to another episode of the Many Faces of Cancer podcast. I am your host, Melissa Grosbel, and joining me today is Becky Bosley. And Becky has been an oncology nurse since 2006, and for the last 8 years, her work has focused on the multiple myeloma community. Since 2018, she has led the Mid-Atlantic Area Myeloma Support Group and also co-leads the International Myeloma Foundation's Living with High Risk Melanoma Special Interest Group, which she founded in 2023. That is a mouthful. This group is always held virtually and is therefore accessible to global participants monthly. Passionate about empowering the myeloma community with education, she leverages her oncology nursing expertise to support myeloma patients and their care partners. As a breast and ovarian cancer survivor herself, she brings a deeply personal understanding of the challenges faced by those diagnosed with cancer. She is proud of the longevity of the International Myeloma Foundation's impact for myeloma patients and care partners, and is honored to be part of continuing that legacy as part of the IMF team. On a personal note, she lives in southern Pennsylvania with her large blended family. She stays busy supporting her children's passions, which include soccer, baseball, volleyball, chorus, and theater. So welcome to the show, Becky.
Thank you so much, Melissa. What an honor to be here. Thanks for asking.
I am so excited to chat with you, and thank you for sending me that bio. I always appreciate when I don't have to make stuff up on the fly for people.
Of course.
And so tell us a little bit to begin with. Like you said, it says you have a large blended family. So how many blended children do you have?
We have 7 between both of us. I have 3 biological and 4 stepchildren, and I am a proud Nona of 2 as well. And we have 2 dogs and a cat here at home too, so it's a bit of a circus, but it's a beautiful chaos, and I love every minute.
And how many children are still at home?
5.
Wow. All
5 of
right.
the
And
7.
you
Yes.
said before we started that that one just graduated high school.
Yes, just last night. So she'll be going off to college in the fall. So such a happy, joyous time and bittersweet, of course. Sad for us to be losing her to go away to school, but so excited to see what she'll do. And she's continuing the legacy of nursing. So we'll see what happens.
That's awesome. I know it's always kind of that bittersweet moment. You know, you can't wait to see how they adult, but then you also miss, the babies that they were.
Yeah, exactly. Exactly.
All right. Well, let's kind of go back to the beginning. So it says you were an oncology nurse since 2006. So what got you into the field of oncology? Because you had not been, you were a long way from your own cancer journey. So how did you get started in oncology?
You know, it's funny. It was one of those, I call them God moments, because I graduated nursing school, really had kind of dabbled in different areas of nursing during school and clinicals, and really hadn't settled on anything specific, and went and interviewed in a couple different areas in the hospital. And I always say, like, I walked onto the oncology unit and it was that moment of like, like that wild moment that you see in the movies. That's kind of how it felt to me. It just felt like home when I walked onto the unit. And I found my home there in oncology and have never left it. I can't imagine doing it, even any other type of nursing other than working with cancer patients. I absolutely love being a part of people's journeys.
So have you moved into like different areas of oncology over your time, or have you kind of always stayed with the same group of people?
Yeah, I have. So that first unit that I worked on was a medical oncology unit. So I saw all different types of cancers there. It was in a hospital, community hospital, nearby where I live. And then I moved after 12 years there. I moved to a very much larger academic institution in Baltimore, University of Maryland Medical Center, and I started working specifically with myeloma patients, and that was in 2017. So it was a big shift going from a community hospital into a larger academic institution. and really kind of found my niche in really the myeloma community is unlike any other community that I've ever been a part of. I worked specifically with myeloma patients there, navigating them through stem cell transplant, and then kind of got involved with the IMF, the International Myeloma Foundation, which we'll talk about there as a volunteer. And I started leading a support group and specifically for myeloma patients, and really kind of got really involved in the myeloma community. And that led me to working here on staff for the International Myeloma Foundation, doing what I love and what I'm passionate about every single day. And work never really feels like work, which is an amazing place to be.
Absolutely. And now, can you tell us, because I know we talked about this when we chatted, what is so different about myeloma versus other cancers that makes this such a passion project for you?
Yeah, there's something about the myeloma community, and myeloma. For those who don't know, myeloma is a currently incurable blood cancer. I always say currently, but because we haven't found the cure yet, but it's coming. So it is a blood cancer. So when patients are diagnosed with myeloma, they know that this is something that they will have to manage for the rest of their life. So it really makes them really dig deep, and not just physically with their physical health, mentally, spiritually, and truly altruistically as well. And people in the myeloma community really want to look out for others who are going to be battling this disease or are currently battling this disease. And we see that in donors. We see that in patients who participate in clinical trials. We see that in patients who become support group leaders or support group members. We really see it in so many ways. So really the myeloma community, because this is now really a chronic cancer, we really do see patients and care partners come together to help support the myeloma community as a whole. So I think that's really what just kind of changes it's not you get a surgery and hopefully they get it all and then it's gone and you're a survivor, or you have, 8 rounds of chemo and hopefully they get it all and then you're a survivor. It's really one of those chronic cancers that you manage, relapses and remissions for the rest of your life. So we really truly, my support group meetings every month, I always say to people, it's my favorite night of the month. I love it. I absolutely enjoy every minute that I get with myeloma patients and care partners. I truly get just as much out of them and my engagement with them that they get from me and my knowledge and leadership of their group.
And is it because, I guess, and I'm still learning a lot about all these different cancers, but from the way you talk, it almost sounds somewhat analogous to actually like living with metastatic cancer, because, you can be NED and then it comes back, but it's, you're always going to be dealing with it, not necessarily from as much of a terminal standpoint as metastatic cancer could be. But is there kind of a similarity, I guess, between the two?
Yeah, exactly. And with myeloma, we watch the numbers, we watch the patients, we watch their symptoms, any signs of relapse. We keep a great eye on their lab work. And when they're in treatment, their numbers hopefully will come down. And then we monitor them while they're in that remission and try to keep that remission as deep and as durable or as long as possible. So it's really managing the disease, not just, fighting it and then, going into remission or becoming disease free or NED. It really is a challenge for life, but one that these patients, I think it's their resilience that makes them so different than any other community. That resilience that chronic cancer patients have to continue that and to, be able to focus on their quality of life, their what it looks like every single day. And then, like I said, giving back to the rest of the greater for the greater good, for the greater amount of the community. It's an amazing place.
I say a lot that, cancer is the worst club with the best members. And
Yes.
it truly is. People just, it's just different once you receive that diagnosis yourself and you all of a sudden, and I mean, I'm not saying that people weren't empathetic and helpful before,
Yeah.
but you just want to be there for other people and you want to help guide other people along the way. And it really is such a beautiful community that, nobody
Mhm.
ever really wanted to join.
That's right. Exactly. It's the vacation you never wanted to take, but you enjoy being a part of it once you're there, you know? Yes, I agree. I
Absolutely.
agree.
And I love when you sent me your bios, several words have like community, you have the both M's capitalized for multiple myeloma. I thought that was very cool.
Yeah, community. We use community with the two capital M's for multiple myeloma. We use family. I think every year, and we'll talk about this a little more later, but every year the International Myeloma Foundation brings support group leaders from across the country in for a summit every year to help kind of educate and engage with these support group leaders and really help them with leadership training and things like that. And we had that hashtag, the family with the two uppercase M's, because that's what you leave feeling like. You have just such an extended family now of people who think like you and want to do the best for this community just like you. So, yeah.
I love that. All right, well, let's shift gears just a little bit because we're definitely going to come back to that. But I want to talk a little bit about your personal cancer journey because I mean, you like for what over 10 years were working with the cancer community, and then all of a sudden, you received a diagnosis as well. So can you kind of take us back to that because you had ovarian cancer first and then breast cancer later. So kind of take us through a little bit of that journey and what that was all like for you, like working with cancer patients every day, as well as dealing with your own
Yeah.
diagnosis.
Yeah, sure. So in 2019, in April of 2019, actually, I was about to turn 40 in May of that year and started having some signs and symptoms that something was going on GYN wise. And went to the doctor, had some ultrasounds and lab work done, and something on the ultrasound didn't look quite right. So they sent me for an MRI as well. And, the benefits and the horrors of having online portals to our healthcare records at 4 o'clock in the morning on my 40th birthday in
Happy
May of
birthday.
2019, my phone dinged and it was the results of my MRI saying that the mass in my right ovary was highly suspicious of a malignancy of some sort. So went in, was referred to a gynecologic oncologist, ended up having surgery. They weren't sure kind of what it was. They just knew that they had to get it out. So I had my right ovary and my right fallopian tube removed in surgery. Ironically, in the same hospital and cancer center that I worked in at the time. So that was a whole experience in itself. Kind of managing being a patient in the place that you work, which was interesting. And the pathology came back during the surgery that it was a granulosa cell tumor, and that is a rare type of ovarian cancer. So, thankfully, it is a rare type of ovarian cancer that typically is taken care of by surgery, getting it out of your body. It rarely metastasizes. So, in the big scheme of things, I got lucky with my diagnosis, if that's what you can call it, right? So the plan after that was kind of close monitoring. Every 3 months, I went into the gyn-onc and got lab work done, ultrasound every year, just very close monitoring. A few years after that, in 2022, started to have some of the same symptoms again that I had initially had with the granulosa cell tumor that brought me to the oncologist in the first place. So went back and there was the thought that possibly it had recurred, which was rare, but you never know. So they ended up doing a total abdominal hysterectomy. And thankfully, it was not a relapse. It was a complex cyst that appeared the same way. So now that, I'd had the hysterectomy, I was only 42 at the time. So they wanted to put me on hormone replacement therapy to kind of replace the hormones that I was going to be losing with my ovaries being gone. So in preparation for hormone replacement therapy, they do some baseline testing. So baseline bone scans, DEXA scan, and baseline mammogram. And at the time, I was 42. Yep, 42 at the time. And had had one previous mammogram that was normal. So in DEXA scan went through, I got the mammogram, and 2 days after the mammogram, I got a call that they found a lump. They found a mass on the mammogram. I could not feel it. Even after I knew where it was and that it was there, I still could not feel it. The only way that I knew was because of this baseline mammogram prior to starting hormone replacement therapy. So,
And hormone replacement therapy went out the window at that point, right?
right, exactly. So, to me and my nursing mind, I felt lucky. I felt lucky that we caught it early. I felt lucky that I had been put in that situation at all to have had a mammogram at that point in time, because I wasn't due for one at that point in time. So if I wasn't in that situation, who knows how long it would have lived there before I knew about it. So I had, in August of 2022, I had a double mastectomy. Thankfully, after the double mastectomy and all the pathology that goes along with that post-surgery, all of my oncotypes and all of my testing and things showed that I did not need post-surgery chemotherapy. So just the double mastectomy was enough. I did have a really challenging recovery from my double mastectomy. Had a lot of nerve pain that lasted quite a long time. And I think I spoke with you before about, typically people with cancer, I've heard it over the years so many times, cancer patients always find that one person that really was their game changer during their journey. The person that really made an impact on their journey and made it easier or softened the blow a little bit. And my physical therapist, actually, that helped me with the neuropathy issues and motility or mobility of my chest cavity. She was absolutely wonderful. I went and saw her twice a week for a year. After my surgery, she was absolutely my game changer. And, at this point, almost 3 years later, in August, it'll be 3 years. It's crazy to think.
Right.
But I have not yet undergone reconstruction. Mentally, I don't think I'm quite there yet. With as challenging as the double mastectomy was, it was, it's hard to think about getting to that place again. So one day, maybe I will, but now's not the time for me. So that's okay. But I am grateful.
Now, is there like the longer you go, is it more difficult? If you decide down the road that you want that reconstruction, is the process more difficult than if you had kind of just gone through it after your mastectomy?
Yeah, no, actually, they do say from a plastic surgery point of view, they actually prefer you to wait, because then they're operating on healthy, fresh tissue that has great blood supply and things like that.
Gotcha.
So we'll see. We'll see. Don't know where that will lead me, but for now, I'm happy, and I can say that I am cancer free at 46. I just turned 46 last month. Yeah. And, it is, again, it's a weird, just like you said, it's that weird community that you never wanted to be a part of, but you're here now. And I can honestly say that it was put on my path for a reason, because it has made me change. It has made an impact on me that I can now, through my work and the interactions that I have with patients and care partners, bring that perspective. It really has changed how I do my job and how I am a nurse.
Yeah, that was going to be my next question is, I've talked to people that they talk differently to people who have gone through cancer versus people who are just in that space. And it's amazing that no matter what kind of cancer you had, no matter what your treatments were, there's just something in people that it's just a deeper level of understanding and ability to open up to someone who has gone through that experience versus someone who hasn't.
Yeah.
And have you found that to be the case?
Yeah. And, I thought, again, I've been an oncology nurse for all these years, almost 2 decades now. And I've always thought of myself as a really great nurse. But,
You
when you,
are a great nurse, I'm sure.
but, you can't truly empathize with someone going through this until you've been through it yourself. And really the impact is so much more far reaching than I ever thought about,
I mean,
for my family, all of my children, my fiance, it impacted every single one of us, my extended family, my mom, my mom seeing one of her children go through this, my parents, it's the reach of a cancer patient is so much further. And that once you go through it. And, it's not just that, like I said, it's not just that physical journey, the emotional journey, the spiritual journey. I know that my faith dramatically improved after or during and after my cancer journey. Emotionally, in the big scheme of things, in the matter of 2 years, physically, I lost everything that made me a female, right? I mean, my ovaries, my uterus, my breasts, everything that physically, identifies you as a female, I lost all in 2 years. Never mind the hormonal shifts and all of those things that happen. That's a dramatic effect. So physically, emotionally, socially, not, the body image stuff, in every way, having cancer has affected me, every way possible.
and now as an oncology nurse, do you, and I haven't had many on the show, but do you speak to the emotional aspects with your patients? Like I know, you've got a job to do and that's not really your focus, but I've talked to so many people on this show that like the emotional impacts are sometimes worse than the physical impacts, and a lot of them feel like they weren't, I don't want to say set up for that, but they had no idea until they were, in the midst of it, that like, nobody told me that this was going to suck in my head too, as well as my body. So I don't know if you, especially now that you've gone through it yourself, if you're able to, talk to patients more about that, or at least try and help them prepare for it and get resources for that.
Yeah, absolutely. And I think that through my roles in the last 20 years, my ability and time and the way that I do that has changed, right? As a bedside nurse, you're right. You have a job to do, you have meds to pass, you have this task to do and that task to do. So sometimes your one-on-one time with a patient or their care partner is limited. I worked night shift for the most part when I was a bedside nurse, and there were many nights where I have one specific patient in my head where I was there the day that he was diagnosed, and literally spent almost all night sitting with he and his wife at their bedside and talking about the emotional journey and what to look forward to and what he could expect as the next steps and all of that. I think back to that, and then as I kind of transferred into the nurse navigation role with myeloma patients, while I wasn't in an inpatient kind of, area any longer. So I wasn't, having all of these multiple patients on my list kind of at a time. I had the time where I could sit in an exam room and really listen. I could talk and listen and really be that resource for someone. And now, in the role that I'm in, my background as a nurse, being a director of support groups now in my role at the IMF, I bring all of that with me, right? So my history as a cancer patient, my history as an oncology nurse, all of it comes together to help support me in what role I play now in a myeloma patient's journey or a myeloma care partner's journey. Because now I do see all of that, right? It's the physical, the emotional, the spiritual, all of that. And, helping them to recognize, one of my absolute favorite topics to talk about, because I think that toxic positivity is quite toxic in the oncology world. Everything's going to be fine. We'll get this gone and everything's going to be fine. Sometimes it's not fine.
Right.
Flat out. Sometimes it's not fine. Sometimes the journey is not fine. Sometimes the outcome is not fine. And it is absolutely just as empowering to feel the good and feel the bad all at the same time and acknowledge both of them, because it's so, so important to do so. Until you acknowledge both and acknowledge that both of those are okay things to feel, then you feel pulled to one or the other. Some days that, as I think about a myeloma patient's journey, every single day for the rest of their life, they're not going to all be up here, right? There's going to be days that suck, just like you just said. There's going to be days that are tough. There's going to be days where you just don't feel like getting out of bed, and that's okay. You know what? Take that day. Let's make the next one better, but acknowledge that day and that journey that you're on, because it is a journey. It is a marathon. It's not a sprint.
And one of the things that my therapist has really helped me with in along the lines of this is that two things can be true at the same time.
Yes.
Like, it can suck, and there are still things to be grateful for at the same time. Because I was like, well, I can't feel grateful because I feel terrible. And, if I'm grateful, everything else goes by the wayside. And it's like, it's not an either or, it is a both and. And that took me a long time to learn, because I won't necessarily say that I'm a toxically positive person, but I mean, I am in general, I'm a very positive person. I like to make people feel better. And I can also acknowledge that, okay, this sucks. And yeah, maybe it's not going to be fine. Like, you are terminal.
Mm-hmm.
It's not going to be fine. And you can find something good in that day.
Yeah, exactly. And when I did work inpatient, I would tell people that I met what I did for a living and things like that, and they would say, "Oh, I bet when people are cured, it's your favorite part of your job." And I'm like, from an inpatient oncology perspective, I didn't see a lot of people that were cured because that wasn't the population of patients that I worked with. What I did see was people going through challenges and people going through infections or, illnesses related to their cancer or new diagnosis, or on the opposite end of the spectrum, death and dying. And my job and my passion was to make every bit of that spectrum dignified and empowering for the patient, because death and dying can be absolutely beautiful. I have been a part of some absolutely beautiful transitions from this world, and I will never, ever, ever say that that is tough or bad part of my job. It is an amazing part of my job. And I love being able to give that perspective to people who are going through it. We're all going to die, right? At one point in time, we are all going to die. We are on this world for a very short amount of time. But cancer patients, when they get to that time, if they do get to that time in their journey, they can empower themselves and they can empower their families to make that experience just how they want it. And that's a beautiful choice that we all have, a beautiful choice.
Wow. Wow. Okay. We don't really talk about that very much. But it is, I mean, it's true.
Right? We should. And,
Yeah.
and I absolutely love talking about it. Palliative care alone. I mean, I won't get on my soapbox for very long, but, palliative care should be consulted for patients way earlier in the journey than end of life. Quality of life. Those palliative care doctors can manage quality of life through a journey. And then the end of life care can be so much more beautiful and powerful for that patient and their families as well.
Wow. Okay. This went in a very different direction than I had planned, and I absolutely love it. And so I'm gonna, it's not like the elephant in the room, but this is uncomfortable for me hearing you talk about this, because I think so many people, when they're diagnosed with cancer, their goal is to kick it, to beat it, to survive, to live, a long life. And when you bring in outside of, when you first hear those three words, like 99.5% of people are like, am I going to die?
Yes.
And then you just put it out of your head. No, I'm going to live. I'm going to survive. And actually talking about, like death is inevitable. Nobody makes it out of here alive. But I got to say, I'm a little uncomfortable hearing you talk about this. And so maybe that's a good thing, because maybe we need to be uncomfortable to actually, move through and have these kind of discussions.
That's right. Exactly. It's good to be uncomfortable. Part of oncology nursing, a big part of oncology nursing, is how to help people through that uncomfortable time. Why we make plans for our wedding, we make plans for our retirement. Why do we not make plans for our transition out of this world, right? Why do we not think about that part? Why is that such a scary step? Yes, when we all get diagnosed with cancer, do we all think I'm going to beat this thing? Absolutely. That's our human response. That's how we should all be. We all want to do that. Unfortunately, sometimes that's not each of our realities. It's just not. So what's our next best step, right? What's our next best step? Live in the uncomfortable, lift ourselves up, and make the best of what we have. Empower your families with what your wishes are. Talk about it. We always used to joke, bring it up at the Thanksgiving dinner table, make everybody uncomfortable. Let's talk about it.
We're talking about politics.
Right, exactly. It's better than politics, right? It's so important. And like I said, I've been a part of so many beautiful journeys into that transition. And those patients who were able to plan and, talk to their families, that transition isn't as scary, and it becomes more comfortable when you talk about the uncomfortable.
Wow. Cool. Okay. And this is going to be a very unsmooth transition, but I do absolutely, and I could talk to you about this all day, because I think this is a really important topic to talk about, but I don't want to lose sight of what you're doing today with the International Myeloma Foundation and the support groups and stuff, because that's really why I wanted to have you on the show, and also why I love not having a guide, because these great conversations happen. But I want you to be able to talk about this. So tell us about the International Myeloma Foundation, what you do, and like support groups, and how vital they are to a cancer journey.
Oh, I love it. And this is something that I could talk about all day,
Yeah.
right? The International Myeloma Foundation is a nonprofit organization dedicated to myeloma patients and their care partners. And we were founded in 1990. So we're in our 35th year this
Wow.
year, which we're very, very proud of empowering patients. And we kind of built everything that we do is built under four pillars: research, education, advocacy, and support. So really the whole patient is what we like to say that we take care of. We provide many, many, many resources for myeloma patients. And my role at the IMF is a director of support groups. And the International Myeloma Foundation educationally supports over 155 myeloma support groups across the country, including
Wow.
Bermuda and Jamaica. So I always like to include those too. And we really, support groups are not the traditional sense, the outdated sense of sitting around in a circle and crying with one another and, all of it's not like that anymore, right? It's support groups are such a sense, they provide a patient and their care partners with such a sense of empowerment, education. Some of these support groups throughout the US, they have speakers every single month or every other month or as often as they design. And these speakers are myeloma experts. They come and they talk to patients and their care partners about what is new and up and coming, what's in the pipeline. In just in the last 20-ish years in myeloma, we've had 19 different drugs approved for myeloma patients. That's a huge, huge amount of treatments that are now available. And that's related to clinical trials, right? So, and research. So again, the
Mhm.
IMF is involved in so many different aspects of myeloma. But when we talk about support groups, that true empowerment and that ability and that sense of community with those two capital M's, that you feel with others who are kind of fighting the same fight, right? They're myeloma patients and care partners as well. And they come together and really share their stories and share what has worked for them and what hasn't worked for them and tips and tricks. And again, talk about that holistic view of a patient, that, physical, mental, emotional, spiritual, all of the different aspects of a patient. The IMF is truly you said in my bio, the longevity of the IMF to me is something that I am really, really proud of. A nonprofit organization to be around for 35 years and to provide as much as we do for myeloma patients and care partners is really fantastic. And I'm so, so proud to be a part of it.
And then what about the IMF's Living with High Risk Myeloma Special Interest Group that you co-lead? How is that different? How is it the same? And, how can people become a part of that?
I love that. So the 155 groups that I mentioned earlier are local groups, right? They're regionally based groups where you can touch base and kind of engage with people in your area. The IMF has also created 7 special interest groups, and these are virtual always groups. So anybody literally in the world globally can join these groups over Zoom every month. And they're designed to really supplement local groups for those specific patient populations. For example, those with high risk myeloma. So I did found, along with another nurse, the Living with High Risk Myeloma Special Interest Group. And we specifically have conversations and talk about what it's like to live with aggressive high risk myeloma, which is different than standard risk myeloma. So these patients and care partners that are in my group with the high risk, They are likely, most of them are in local groups in their own regions, but those local groups have all kinds of myeloma patients in them, right? Not specifically high risk patients whose characteristics are quite different, their needs are quite different. So it's important that we bring those folks together. And as you were talking about the uncomfortable, with high risk myeloma patients, we talk about treatments, we talk about, what makes high risk, and, all of these different things, but we also do have those hard conversations. We have those hard conversations about the uncomfortable. And I think that that's why, a big part of why I am so comfortable with it, because we do talk about it often. Again, the physical, emotional, psychological, social, sexual health, again, a huge topic that we've not even touched on yet. All of these things are important and they all play into us as humans. So the high risk group is near and dear to my heart. Every member of that group knows how I feel about them. We talk often, and they know that our group is a safe space, and that's what it's meant and designed to be, a safe space for them to talk about their journeys. And we encourage their care partners to also join them in this group, because it's important. It's important to involve the whole patient and the patient system. The care partners of a patient are important to be included in that.
I love that. Just the importance of support groups all around, just
Mm.
being around people who, who get it, who understand.
Yeah.
I was in Florida last week and talking to my mother-in-law who has, she has autoimmune issues. And, I'm like doing some research to try and find her a support group because she's got her partner and that's it. She doesn't have anybody else
Yes.
to talk to about it, who understands. And so, yeah, I cannot stress the importance of that support and being around other people who know what you're going through to
Yeah.
help you, to help you navigate these situations.
Yeah,
Absolutely.
absolutely. Absolutely. And the IMF, when we talk about, education and really how much we know as myeloma patients, or how much the myeloma community has kind of empowered themselves with education, the IMF also sends a group of support group leaders to ASH every year. That's the American Society of Hematology meeting and exposition. It usually happens in December. We send a group of support group leaders there, and these are patients, care partners, healthcare providers who are support group leaders in their own areas. And then they go to ASH and they're sitting in chairs right next to myeloma researchers and myeloma specialists. And they're hearing right as it happens the results of these studies that are groundbreaking. And then these patients that the IMF sponsors to be there, they then are able to share all that information in blogs and videos and social media posts, so that the global myeloma community is hearing updates as they're happening. You cannot be more empowered than that, right? I mean,
Right.
hearing that research and the results of clinical trials come out as researchers are hearing them, that's important. And I'm really proud of that Myeloma Voices at ASH program. And I love being a part of it.
That's awesome. All right. Well, Becky, where can people find you? Where can people get in touch with you? How can they find the IMF? How can they get involved in, support groups if they so choose?
Absolutely. So the IMF's website is myeloma.org. So please feel free to visit the website. It is a wealth of information. At the top, there'll be a button that says resources and support, and you can find a support group there at support.myeloma.org. You can always reach out to me and the rest of the support group team at sgteam@myeloma.org. Please feel free to do so. And you can follow me on social media as well. I think that my information for LinkedIn and X will be on the podcast.
Absolutely. And I would put all of this in the show notes as well as your email. Can people just email you if they have further
Absolutely.
questions as well? Awesome.
Absolutely. Look forward to talking
Um,
to them.
I'm sorry, what were you going to
I,
say?
I look forward to talking to them.
Awesome. Well, thank you so much for your time. Thank you for being on the show and, talking about these very important topics that might be uncomfortable to some, including yours truly. I really appreciate that.
Absolutely.
Right? The
Thank
only
you
way you
so much.
grow is by being uncomfortable.
Yeah,
Yes. The
exactly.
only way you grow sometimes is by being uncomfortable. So I
Yeah.
appreciate that. All right.
Yeah.
Well, have a wonderful rest of your day, and we will chat again soon.
Thanks, Melissa. Take care.
All right. Bye bye.